Our first video in this series will be about the olfactory nerve. This is Mohammed Raz, and this is your knowledge platform about the brain, spine, and beyond. So as you can see in this wonderful dissections by Rhoton, the olfactory nerve here is highlighted in yellow, and this is seen from a superior view as it's traveling from above the optic nerve and then entering into the olfactory groove and terminating into the olfactory bulb. So it's again going from all the way posteriorly from the optic nerve and then moving to the olfactory groove and terminates in the olfactory bulb, where it gives rise to short olfactory nerves that then passes through the Cribriform Plate. If you look into this picture, the olfactory groove is medial to the ethmoid sinus, which is highlighted in yellow here, and anterior to the sphenoid sinus. So again, that's the ethmoid sinus and the sphenoid sinus, and we can see the olfactory groove is just medial. Here you can see the olfactory tract and bulbs are seen from the anterior perspective in a subfrontal approach. So here we're kind of going subfrontally, the brain is lifted upward superiorly or to the higher up. You can see down here the optic chiasm and the optic nerves, and you can see the olfactory tracts kind of attached to the base of the brain. Here we have an endoscopic view, which is really nice. We can see the Cribriform Plate highlighted in yellow, which basically perforated by the olfactory nerve fibers from the olfactory bulb, which supplies the olfactory mucosa. Then here we see an endoscopic view again with an intact olfactory mucosa, which is inferior to the Cribriform Plate of the ethmoid bone. You have the special sensory neurons in this mucosa, which give rise to the olfactory nerve that pass through perforations in the Cribriform Plate to terminate in the olfactory bulb. And the ethmoid air cells have been removed laterally. Again, from an endoscopic view, you can see the olfactory mucosa has been separated from the Cribriform Plate, and the anterior ethmoidal artery here, which usually supplies the olfactory groove meningiomas. Here you can see the olfactory bulb, which is highlighted in yellow again, directly, immediately over the Cribriform Plate and the olfactory mucosa. And then we have the olfactory tract is also seen more posteriorly. Here is a basal view of the brain, looking from the base. Wonderful picture. You can see the olfactory tracts, which courses posteriorly along the gyrus rectus. Here is the gyrus rectus and superior to the optic nerves until it reaches to the olfactory trigone. Here the olfactory tract, as you can see anteriorly in the front in this picture, which divides into three stria at the olfactory trigone. The medial olfactory stria, which we cannot see here, which terminates in the septal region, and the intermediate olfactory stria, which terminates in the anterior perforator substance, which lies anterior to the uncus. Lateral olfactory stria, which is this one, terminates in the structures around the uncus. You can probably look at some of the drawings around this area so you can understand the divisions of the olfactory tract. I'll just go through that again. So we have the olfactory tract divides into three stria. We can't see the medial olfactory stria, but we can see the intermediate olfactory stria, which basically ends into the anterior perforator substance, and then the lateral olfactory stria, which terminates in around the structures in the uncus. The intermediate olfactory stria courses to the anterior perforator substance, which you can see here in yellow. The olfactory nerve has a simple anatomical course. I hope that you find those dissections and this anatomical lesson well understood. Stay tuned for the next video. We'll go through the dissections about the optic nerve.